Assalamu alaikum. Welcome to my channel. In this video I discuss general anatomy of joint. Joint is the articulation or junction between two or more bones or part of bones of the skeleton, whether there is a movement between them or not. Three types of joint are classified according to the manner or type of material by which the articulating bones are united: fibrous joint, cartilaginous joint, and synovial joint. Fibrous joint. Its occur where the bones are separated only by the connective tissue and movement between them is negligible. There are three types of fibrous joint present. The suture. This joint usually found in the bones of the vault of the skull, gomphosis, dentabular joint, and syndesmosis, radioulnar joint. These are the different types of suture joint: plain, squamous, limbous. This is the gomphosis, and this is the syndesmosis. The cartilaginous joints are a type of joint where the bones are entirely joined by cartilage, either hyaline cartilage or fibrocartilage. These joints generally allow more movement than the fibrous joint, but less movement than the synovial joint. There are two types of the cartilaginous joint: primary and secondary. Primary also known as the synarthrosis, and secondary also known as the symphysis. In synarthrosis, the bones are joined by the hyaline cartilage, and synarthrosis are found in the epiphyseal plate of the growing bones in children. The primary cartilaginous joint or synarthrosis is mainly seen in the developing appendicular bones. And this joint are temporary joint, and within 18 to 20 years, this joint is disappear. Secondary cartilaginous joint is mainly found in the midline of the body. These are the permanent joint and slightly movable, and it is usually formed by the fibrocartilage. These are the example of the secondary cartilaginous joint: intervertebral disc, sacrococcygeal joint, symphysis, sacrococcygeal symphysis, or pubic symphysis. This is primary cartilaginous joint, this is secondary cartilaginous joint, and this is the difference. This is two bones is articulated by hyaline cartilage, two bones, and this is the articular surface of the bones is covered by the thin plate of hyaline cartilage, and two hyaline cartilage is separated by the fibrocartilage. This is the structure of the secondary cartilaginous joint. And primary cartilaginous joint is not moved, but limited amount of movement is seen in the secondary cartilaginous joint. This is the permanent joint because the fibrocartilage cannot convert it into bones, but this hyaline cartilage is converted into bones after 18 to 20 years. So this is the temporary joint. And this joint usually found at the growing end of the long bone, and this bone mainly found in the midline of the body, pubic symphysis, intervertebral disc. Synovial joint. Synovial joint is also known as the diarthrosis, and joint bones or cartilage with a fibrous capsule that is continuous with the peristeum of the adjoining bones. So this is the articular surface of the bones, which is covered by the articular cartilage. This is actually hyaline cartilage, and this is joint cavity, and this is the fibrous capsule. It has outer fibrous part, inner synovial membrane, and from synovial membrane a fluid is secreted which fill the joint cavity, known as the synovial fluid. So these are the features of the typical synovial joint. The articular surface is covered by the articular cartilage, hyaline in nature, contain a joint cavity which is filled with the synovial fluid. Joint cavity is enveloped by a complete articular capsule which consists of outer fibrous capsule and inner synovial membrane. The articular bones are connected by a number of ligaments. Sometimes the joint cavity is divided completely or incompletely by the articular disc or menisci. Usually these are the fibrocartilage. So this is single joint cavity. This is articular cartilage and this is the articular capsule, outer fibrous part and inner synovial membrane. And this cavity is filled by the synovial fluid. The classification of the synovial joint according to the number of articulating bones, simple, compound, complex. Simple when the joint is formed by the two bones, compound when there is more than two bones, complex when joint cavity is divided into two compartments by articular discs. And according to the axis of the movement, it is unicellular, bicellular, multicellular. Unicellular joint example, pivot, plane hinge, and biaxial, saddle, condyloid, and ellipsoid, and multiaxial ball and socket. According to the shape of the articular surface, joint are pivot, plane hinge, saddle, condyloid, ellipsoid, and ball and socket. So pivot, there is a circular articular surface and there is a cylindrical shape bones. And movement is rotatory movement occur. The rotation of the radius during pronation or supination. Example, hinge joint. One articular surface is convex, another articular surface is concave, and movement is occur in the one plane, the flexion extension of the elbow joint. The plane, both articular surface is plane. There is a slight gliding movement is occur in this joint. The saddle, one articular surface is convexo-convex, another articular surface is convexo-convex, and permit movement of the two directions, the biaxial joint. Condyloid movement, there is a two biconvex articular surface and corresponding biconcave articular surface. And the knee joint is the example of condyloid joint. Ellipsoid, one articular surface is oval and another articular surface is concave. This is ball and socket. One articular surface is ball-like and another articular surface is socket-like. The shoulder joint, the hip joint is the example of the ball and socket. And wide range of movement is seen in this type of joint. So this is all about joint. If you like this video, please press the like button. Please subscribe.